Hi, Life Activated family. Thanks so much for joining us today. We want to bring you as much value as possible in this group over the next 30 days. So today I get to sit down with my friend Stacy Tarrh. She is the owner of this beautiful Pilates studio in Rockford called Rockford Pilates. And I just kind of wanted to educate you a little bit about different types of exercise. And this is something I came into a year ago and I have just loved it. It's brought a lot of great benefits to me. And I kind of went in blind, not knowing much about it. So I thought I'd bring Stacy in today and kind of give us kind of a rundown of some things. I have some questions that might help answer for you. And I know Stacy comes from a PT background.
Yeah.
This is not her first thing. So kind of tell us a little bit about that and kind of how it brought you into the studio.
Sure. Yes, so in 2006, I graduated with my doctorate in PT, and then I practiced mostly outpatient orthopedic for 5 or 10 years, and I loved it, loved what I did. But I would say after a couple of years in the clinic, I just started seeing limitations with clients that were consistent. So a weak core, poor posture, muscle imbalance, some of these things that people were coming in with that was limiting their full recovery, or were things we had to continue addressing. And then when I discharged them from PT, we were able to make improvement. They wanted to keep moving, but I wanted to feel like I had an option for them where they could safely keep moving. And so around that same time, I'm starting to ask these questions like, how can I help fill in the gap for my patients for some of these things and help them with more the preventative side? Like, what could you do to be proactive that you don't keep having this injury? I was introduced to Pilates, so I started trying it, and I just felt like it checked a lot of the boxes that I felt like the general population could benefit from, regardless of their age or gender. And so I became a big fan, and obviously that just continued to grow because I decided, you know what, I really want to bring Pilates to my community, to Rockford, and help people find a form of movement that meets them where they're at and helps them age well. So
I love that. That's actually
this.
kind of what brought me in. I was actually having some shoulder pain, and I kind of went to a PT type of thing and gave me some exercises, but I thought, you know, I feel like a lot of this is stretching. So that kind of answered one of my questions is, you know, how it can support other wellness goals, like, you know, posture, core strength, you touched on that, but also any specific injuries where it was helpful, like back pain, post-surgery, things like that. I know it's really helped my shoulder with the stretching, so what else have you seen the benefit in that?
Yeah, you know, I think it might be a little bit more diverse for me just because other clinicians in the community know that I'm a PT, so I'll get people, you know, post hip replacement or chronic low back pain, and they're going to be people that probably end up on my schedule, at least in the beginning. But they transition really, really well to our Pilates classes. We have different levels of classes. So once myself or another instructor approves them, like, yep, okay, you're good, then they can transition to a group class. And I would say, I mean, I think Pilates is good for everybody, truly.
That's one of my questions,
But I would say we've had really, really good success for people who have more of a chronic pain, whether that's back pain or hip pain. Because I think when you're in pain for a while, you can get afraid of movement. So you hurt and you want to move, but you don't want to move in a way that hurts you more. And so bringing them in and educating them and training one-on-one and then transitioning them to group classes is really life-giving for them because it opens up the idea of I can move again. I don't have to be so afraid. I don't have to be so guarded. And we can help re-educate and retrain their body for how to move safely.
I love that. So for somebody not even knowing what Pilates is, how would you describe it? Like, how is it different from other forms of exercise like yoga?
Sure. Okay, so I would probably just generally describe Pilates as a low impact form of exercise that focuses on strengthening and lengthening the body. And it kind of highlights improving posture, improving core strength, flexibility, and balance. Balance is another thing I feel like people really appreciate here, that, you know, as we age or after an injury, just our stability can be affected. And so that balance piece can be a helpful piece as well.
I love that. And so talking about Pilates, we have what's called reformer, like we have here.
Yeah.
So how is the reformer Pilates a little different than maybe a traditional wall Pilates or people do on a mat?
Yeah. A lot of the core principles are the same. So concentration, centering, breathing, flow, like the Pilates principles are consistent, But where mat Pilates would be more on a mat with body weight being your resistance, on a reformer, what's in here, the resistance comes from those springs. You're very familiar with those. So we have different levels of springs that provide resistance that also can be layered on with body weight, and then that carriage. So a portion of the reformer moves or slides on wheels, and so you also have that component where there's this carriage that moves as well, where the floor is stationary. Different views. Some people say floor Pilates, mat Pilates is ideal. Some people say reformer Pilates is superior, but I think there's a place for both and they complement each other well. Even in class, I mean, I'm sure you've had it too. We'll do a little bit on the mat on the floor, and then we might take it deeper then on the reformer and say, okay, now what we just worked on, now do it on the reformer and feel this movement and connect that way.
Yeah, which is what I love, and you kind of touched on it a little bit, but this is really something that any age, any physical ability can do because it's really adaptable, right?
Yeah, 100%. So anywhere from young athletes to people in their 70s, we have a variety. And in some classes, they can be combined and safely because we can do different springs, or a lot of our sequences that are pretty familiar or pretty consistent will have layers that we can add. So it makes it accessible for someone who's just getting back to moving or someone who really wants to challenge their movement. I think it's safe for everybody.
Yeah, so leading to that then, what are some maybe misconceptions people tend to think about Pilates when they come to you?
Yeah, two that I'm trying to dispel. It's only for women. It's great for men too. And then that really it's just what dancers do. And I think we have people who would be kind of the dancer physique or passion, but I am not a dancer. I am not flexible. I'm a runner. I'm a basketball player. And it is such a nice complement to other activities that I enjoy. And also Pilates was originally started by a man named Joseph Pilates, and he developed this form of movement to help rehabilitate men injured in war. In World War I, which might also be why it connects with me, just the rehab side of it. Like it's very intentional, functional movement. And so, no, it's not just for sometimes I call it Instagram fancy movements, you know, like that look flashy but are not functional or necessary at all. That is really not what our classes look like. No. They're very purposeful and they work on the things that we've touched on, and I love it.
That's awesome. And how often do you think someone should do Pilates or to feel the benefits or see benefits?
Yeah, well, I mean, even once a week is not wasted because it's movement and it's good and it can be a complement. But it depends on how active people are. So if people have a pretty consistent routine that's working well, that once a week to get in maybe some stretching or more core work is still beneficial. But if they're trying to start a movement program and they want this to be their primary thing, I think 2 to 3 times a week really helps them carry over session to session some of the things we're working on and see some of the gains that they're going to make.
Right, and I noticed, and I don't know if this is the same with all studios, which I love this one, is you have different levels or maybe how you're feeling. We have like the flow, and then we have the power for maybe somebody that's more fit, so it's really, really adaptable.
Yeah, exactly. And jump board. So our jump board is a little bit more cardio based and does have some impact to it, but still lower impact. So just like you're saying, exactly right. Like sometimes you just want a flow class. You just want it a little slower. You've had a stressful day or week and you just want to kind of connect to your body and ground yourself and feel the stretching, or sometimes you want to get after it. We have a class that you can do that in too.
So that kind of leads me to how Pilates contributes to like overall wellness, including mental health and stress relief. Like how does that impact the body for that?
Yeah, I think just movement in general is so important for our mental health. So my encouragement, I mean, I'm a big fan of Pilates, obviously, but sometimes it's just not what people are looking for. So I encourage anyone to find a movement that they enjoy and to make that a regular part of their life. But speaking for Pilates, the mental aspect of it, I think it creates a space in a really busy culture where we're going from sun up to sundown, and it creates a space where you get to come in. We're trying to really create an environment that feels safe and warm and calming, and you get to just leave everything on the benches or at the door
Right.
and connect to your body. And we do breath work that also helps just calm down our nervous system, calm down that sympathetic nervous system that's like the fight or flight, and help increase that parasympathetic, which is like, oh, rest and relax, like I can breathe deeper, I can calm down, and help remind our body what that baseline is for the calm. And I think that's huge, not only physically, but even mentally as well.
Absolutely. I love that. So if someone is hesitant to like try it, because they have all these fears, what kind of encouragement might you give them to give it a try?
Yeah, well, you just never know unless you try.
Right.
So truly, like, do it afraid. Everyone who comes in here and it's their first time is a little bit like, am I going to be a fish out of water?
Yeah.
Like, what is these straps? What are these reformers?
Yeah.
They sound medieval.
You're
Like,
right,
what are we doing?
It's fun.
Yeah, but
So if somebody wanted to come down to Rockford, it's Rockford, Michigan, to try a class, like it's their first time, how do you kind of introduce somebody into it?
yeah, good question. So there's two options. We have a free trial class. So every other Saturday, first and third Saturdays of the month, we have a class just for people who are brand new to Pilates, and it's at 10 o'clock. You have to reserve a spot, so if you're local, please don't show up. Reach out to us first, because we're limited to only 6 people. Our class size is small on purpose. Yes, and so that class is like just an intro. Like, here's a reformer, here's the foot bar, here's your springs, this is the resistance. It's really just going to intro them to the equipment, and then we introduce some of the more common sequences. And then based on how that goes, that we would suggest next steps, which might be a couple one-on-one sessions, or we could talk about a group class that might be the right fit. But outside of that, I usually suggest that everyone starts with a foundation package, which is 2 50-minute private sessions with an instructor. And that is, number one, so they can try Pilates and see how it feels, if it's what they're looking for, so that we can watch them move, because while they're moving on the equipment, we're also learning things about their body, so we can tailor those sessions to them. Like, oh, okay, actually, I want you to do that, but I want you to turn your core on first. Here's what you need to do. So we can educate so that they really can be safe and get full benefit in classes. And often after those 2 sessions, people are ready to transition to maybe a flow class, but some people love one-on-one and they just continue with them, or do one-on-one once a week and a group class once a week.
I love that because it's so personalized. I know when I did that, it kind of takes that stress off there, because it's like, okay, I'm not in this class going, what am I doing? And looking around.
Everything's new.
So, and like you said, you can kind of get, okay, this person has a little more flexibility. And so overall, I just think Pilates is probably one of the best overall exercises that everybody can really enjoy. And I so appreciate you taking the time today to kind of give us a little education on that. If you guys want to try it, I highly encourage you to do it. It's for all fitness levels. It just gives you it's just a feel good, right? And we know as we age, especially when we get over 50, we need that more than ever, because that is a key element to aging faster, is losing that flexibility and losing that muscle strength. So thank you guys so much for joining us today. I hope you learned something, and definitely come down if you're close in this area. Check out Rockford Pilates Studio. I know you'll love it.